Assalamu alaikum and welcome to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all have a very nice start and a blessed start of the month of Ramadan. And for some of you, it is third Rosa today, and for some, it is second Rosa today. So hopefully, Alhamdulillah, you all had a nice, blessing start of the month. As we all know, whenever we Ramadan starts, we do a very special edition of Health and Fitness Show. And today's edition is very special because this program is broadcasting live from the online platforms of Inspire FM from on 15th of uh, April 2021, and casting its positive vibes to all our lovely people via Facebook and YouTube. And definitely and hopefully, our listeners on radio can hear us on Saturday at 1 p.m. And hopefully, on Saturday, our positive airwaves will go all around Luton and Dunstable areas, Luton, Dunstable, Harpenden, and Bedford areas, and surrounding areas. And also via the Inspire FM website platform. So today, so if you're listening us today on Thursday, which is 6 p.m. That means we are live. We are live on Facebook and YouTube channels. So good evening, and as we all know, we cover different health related topic every single Ramadan, and Ramadan is one of the time. Ramadan is the time when we do very unique topics, especially when we cover about health and fitness in this section. So today's topic is very unique as well because we are talking about medical preparation in Ramadan. Yes, medical preparation in Ramadan. So whenever Ramadan starts, we do special medical preparation in the month of Ramadan, and it as it says, it brings many different challenges to all our lovely people. And I'm not the only one who will be talking about it. As you can see, I'm joined by my two lovely guests today, and they are Dr. Amna Hawash and Dr. Sophia Azhar. Assalamu alaikum, doctors.
Walaikum assalam.
Alaikum salam.
How are you guys?
We are fine, alhamdulillah.
Alhamdulillah,
Yes,
alhamdulillah, alhamdulillah. So at least today, Amna, I have not pronounced your name wrong. That's
My
a good
name
start.
finally. I was very happy.
Alhamdulillah, alhamdulillah. How are you guys? How's the Ramadan start for you?
It's been good, yes. Bit tired.
I think it's always easier than you expect. I think sometimes you kind of dread it knowing you're working or it's a long day. But actually, alhamdulillah, I think it's gone well. It's the third one for us. So yeah, it's going by quickly.
Alhamdulillah. Yes, it's third one for all three of us in a sense. But
Ah,
Alhamdulillah, Alhamdulillah, Alhamdulillah. It's always nice to have a blessed month of Ramadan. So as the topic says, if anybody, any of our listeners or viewers listening us or viewing us like to ask anything about the month of Ramadan or about your medical health problems, please do send your comments on the Facebook or YouTube comment boxes. We can see them, we can hear them, and definitely I will ask my colleagues to answer them as well as it comes along. So let's begin our show tonight. So our show today is very unique, as I said, because today's show is just been done on the online platform. So if you have any comments or queries, please leave your comments on our Facebook chat or our YouTube chat. The show is again exactly the same. So we will be catering the show just like we are doing a normal show on air. So people who are on air hearing a live Aftari broadcast and not this broadcast. So that's why this is very unique and a special show. And our listeners on radio who are listening us on Saturday, definitely it will be a recording for you guys. So anyhow, let's start our show tonight. As always, let me ask our ask our guest to give a quick introduction about themselves to our listeners and viewers. So let's start with you, Sophia.
I'm Dr. Sophia Azhar. I'm one of the GPs in Oakley Surgery.
I'm Amna. I'm one of the GPs in Barton Surgery and at Leave Health.
Perfect. And how's things going on in your GP surgeries? As you know, it's the second Ramadan in COVID. I remember the very first Ramadan was even harder than this one. So, what's the difference you guys have seen from previous Ramadan to this Ramadan beginning?
I think it's
I
too
mean,
early to say what difference yet. It's only been 3 rosas, so not much difference yet. But we are seeing more patients, I guess. Last time we were completely in lockdown, and this time we are seeing patients and dealing with them like not normally like we would have, but at least something is getting there. I mean, getting better.
I think,
Definitely.
yeah, I think we will never get back to probably how we used to deal with patients before and how our GP surgeries used to run, but we're certainly kind of a lot more okay with the new normal of kind of speaking to people on the phone first. But we are open and we are available to speak to anyone and bring them in if needed. But we're just doing that in a kind of a safer way and making sure that you're seeing by the right person at the right time. So please do get in touch if there is anything that either you've not had a chance to talk to anyone about for this whole year through lockdown. A lot of people have been ignoring things because they haven't felt that it's safe, but it is safe to at least speak to us and we can do an assessment, whether it's related to Ramadan or not.
Indeed. So, as I said, it is the second Ramadan in COVID era. So, what challenges you see as a GP for your patients?
I think probably the main thing I would say if I start off is isolation, really. You know, usually Ramadan and Eid is a time where all the families get together, all of the extended family, friends, you're having iftars with large amounts of people. And although lockdown has eased slightly, we need to remember that the cases are still going up. COVID is still very real and very serious to a lot of people who do get it, and we do need to make sure that we're keeping in touch, keeping up with the government guidelines and not breaking them just because of fasting. And the same, with Taraweeh prayers. So I think people have been finding that quite difficult. We've been in lockdown for over a year now. Some people have been shielding, have not seen any of their friends and family for such a long time. And they're just really kind of waiting to do that in this month. But we just really have to be careful. Things have eased a little bit. We can meet outside, groups, 2 families now can meet indoors. But apart from that, we still do need to be really careful.
Indeed. So, when we talk about Ramadan, there are people who definitely suffer different kind of symptoms. Some of them still suffering from COVID. There are still some people who are coming positive. So, is it okay to fast while suffering from those symptoms identified as a COVID symptoms or some kind of a reactions from COVID vaccines, like cough, cold, flu kind of thing? Sophia?
So I think it depends on how you're feeling. So with any medical condition, you need to see how you're feeling. If you have severe symptoms of COVID, that would mean a shortness of breath, difficulty in breathing, or you have a high fever, you take painkillers regularly, you need to drink water, you need to hydrate yourself, then it wouldn't be advisable to fast in that condition because it can make it worse. And you need, maybe some people are taking other medicines as well with having COVID. So I don't think it would be advisable, but yes, you should see how you're feeling. I mean, if you are COVID positive but asymptomatic, then yes, you can fast. But if you have symptoms, I would say avoid fasting.
So, sorry, Amna, you're
No,
saying something.
and it is really important to kind of have that conversation with your doctors. We're all aware, not just us as Muslims, but all the GPs are, aware of how important it is for Muslims to fast during Ramadan. So when we're advising people to not fast, there's a very good medical reason for it. And we have to remember from a religious point of view that actually we are allowed to not fast if you're unwell. Allah has given us that kind of dispensation, so we need to take it if we need to, and that's not a decision that you have to make by yourself. You can have that discussion with your GP or any other health professional.
Indeed, indeed. And when we talk about medical reasons for not fasting, so medically, who should not be fasting?
So pregnant ladies who are pregnant, who are expecting, they shouldn't be fasting. Then there are people who have diabetes, but that depends. If they are insulin dependent diabetic patients, then they should, or they don't have good control over their blood sugars, they shouldn't be fasting because their blood sugar can go up and down and they can go into hypoglycemia or hyperglycemia, which is not good. High blood sugar, low blood sugar. Then it depends on people who have lung diseases, how bad their lung diseases are, because some people need to use inhalers, I think. And then in some conditions, I think some people say that it's okay to use inhalers, but in other people say it's not okay to use inhalers while you're fasting. So then
Mm,
it's better not to, fast because your condition doesn't allow you to fast.
mm.
I mean, of course, if you have kidney problems, I think that would also be one of those things. Probably not to fast because your kidneys can go into dehydration, get worse. What other conditions, Amna?
Obviously, women who are on their monthly cycle, on their period, they don't fast. And I think the important thing that I would say from a kind of a health and wellness point of view, for if you're not able to fast, whether it's something related to COVID or a long-term condition that you have, is that there are lots of other things that you can be doing to make the most of this month. And we need to kind of have a wider view of what is possible to make the most of this month. I think that's what I would probably advise people to do. If you've had a conversation with a health professional, if you have a medical reason, if you're on your period, there are lots of things that you can do, and you can speak to your imam that can kind of give you a bit more information. Sophia mentioned about the inhalers. There are lots of different schools of thought. We can give you as doctors the medical reason, yes, you need to be on this. If you think, actually, I don't know what what my school of thought thinks about that, then you need to have a conversation with your imam and go forward with that.
Yes, indeed, and you have spotted a really valid point that there are different school of thoughts who say different things. There are a school of thought who do say that yes, inhalers will not invalidate your fast. However, the other school of thought says that it does. So yeah, there's a very mixed opinion or very big difference of opinion comes in play. But then. One of Imam Saqib, who was with us on a last week Friday health and fitness show, and he mentioned a very beautiful quote. He says that if Rosa is a gift from a person to Allah. So and Allah also have given you some kind of a relief as in the form of gift back. So if you're not well, that's some of the relief which Allah has given you. And it's like if you're refusing those relief, it's like you're refusing a gift from someone and throwing back on his face. So you do not want to do that, especially it's and it is permissible for you to either make those fasts on later on days, because we have that luxury in terms of December months where days are very shorter.
Yeah.
And whereas in other countries like Pakistan or any other places do not have that luxury.
Yeah.
And also the second luxury is we can always give fidya on behalf of a small charity for not observing fast. But yeah, that is very true. But in terms of the fast, what happened if someone fasts but not supposed to fast? What happened to that person in terms of health wise?
But,
What do you mean by that question? Because I mean, if somebody is fasting and they are able to keep the fast, but they're not supposed to fast, I mean,
I
I
mean,
guess
two different things, isn't it?
like what the condition is. So
yeah.
it may be if,
Oh.
for example, you have kidney problems or something like that, and you're not allowed to fast because you should be on tablets, you should be making sure you're well hydrated and drinking plenty of water throughout the day, that kind of thing, that can really affect your health massively and cause serious problems. Obviously, in a broad sense, we can't say everything that can be caused, but certainly with kind of diabetics, if their sugar control is wrong, you can faint, you can go into a coma, you can die. So it's very, very serious. If a doctor has told you that you should not fast, You know, you need to not fast if that is the medical advice, or you need to be very clear and have that conversation to, okay, well, what can I do instead? What are my limits? Could we maybe make some changes to my medication or the way I'm receiving my treatment, for example? Because some treatments are permissible, some treatments are not. So I think we mentioned a little bit about kind of inhalers, but things like a blood test. So the majority school of thought say that actually you can have a blood test because that's removing something, it's not actually putting something in. Similarly, one thing I wanted to mention on that point was about the COVID vaccine. So the British Islamic Medical Association has done a lot of research, has published lots of things online that people can have a look at if you just type British Islamic Medical Association vaccine. Put a lot of data, they've spoken to a lot of imams, and the consensus is that having the vaccine while you're fasting will not break your fast. So again, if that is offered to you, because at the moment we are still only giving the vaccine to those higher risk people who really should be having the vaccine, and your only concern is the fact that you're fasting, please have that conversation. Not in Luton, but in other parts of the country, there are they are giving vaccines after your fast, you know, after Maghrib time. That's not happening in Luton, but personally, I don't see a need for it because, like I said, the consensus is that it doesn't break your fast.
It was raised in a meeting to run a similar kind of pilot in Luton, but however the problem, again, the same thing, is that when you break fast, there's Tarawih and there's other ibadats where people normally rush towards, and definitely when you did not had any food, when food comes in play in front of you, so those kind of things do count as well, and hence it is not easy to do that, especially after opening the fast. So hence it was an idea which came up and then is scrapped later on. But hey, it is something which is there. But and if you are worried that you may feel some kind of a side effect, have it pretty much around the end part of the day, or a last appointment, or speak to the place where you're going for your jab. That can you have the jab around 7 o'clock or something like that in that case. So yeah, quite possibility, we never know. One thing I have learned in this country is that if you don't ask, you will not get, right?
Exactly. And actually people are so accommodating, and we want the most amount of people to have their vaccine, so we can be accommodating as much as possible. But also a lot of people will not get any side effects at all. So I've had both my doses, I've had no side effects at all from either dose, alhamdulillah. So obviously some people do have side effects, and we can talk to them about that, but they do tend to be, you know, quite minor, and the vast majority will resolve after the first day. So even if it is that one day that maybe you're not able to fast, then we've already talked about what you can do in that circumstance.
How about you, Sophia? Did you had your dose, both of them?
Yes, I had both of them. Yes. Yeah.
And any side effects?
I just had pain in the arm. That's all. That's the only side effect I had.
It's okay. We can deal with a little bit of pain.
It was fine. Yeah, I was okay.
Indeed. Okay, let's move on to the long-term conditions, as the ones which you have mentioned, that we should not fast. But what precaution a person should take if they want to attempt fasting? So I will go from categories to categories, and I do like you to kind of give a expression of understanding to the people. So, like for example, what precaution a person should take, a diabetic person should take if he or she wants to attempt fast?
So I think they need to make sure that their blood sugars are in control before they do attempt to fast. And then if they are on tablets, if you speak to the GP, they can tell them how they can take the tablets. There is a way diabetics can take the tablets when they're fasting. And then they're supposed to, I think, check their blood sugars before fast, and then after, when they break their fast, when they fast, then they can check their blood sugars. And of course, if they feel a bit unwell during the day, they can check the blood sugar again to make sure that their fast is, their blood sugars are fine. So, and of course, they should also have a proper meal. Like they should have a proper sehri, and they should have a proper iftari. and they should have enough fluids in that during that part they can, to keep themselves hydrated.
And regarding the medications, do we have to change the medications accordingly as well?
Yes, you might have to. So everyone, I think it's very dangerous when people kind of class all diabetics as the same, and then somebody says, oh, but my next door neighbor, he spoke to his GP and he said carry on with the tablets, they're fine, so I'm just going to carry on, I don't need to speak to my GP. Actually, no, it is very important that you speak to your GP, especially if you're on something like insulin. The type of insulin might need to change. Like we said, certain types of insulin, depending on what your blood sugars are, you might not be recommended to fast. There are ways, as Sophia said, we can change the type of medicine, the timing of it, and we can give you very specific advice to you in terms of what things you can eat. But on a general note, I think it's important that we're all drinking and eating the right foods. And I think this comes up every single year, not just even from a health point of view or a doctor point of view. Just, people are always talking about avoid the fried food, the samosas, the really heavy foods, the really sugary sweets that we have and we all love. But all of those things will make you more dehydrated the next day. And if you have a condition like diabetes, the fluctuations in your blood sugar may cause you to be very unwell. And if you are deciding to fast and you have come to that agreement, it is with an agreement that actually, if you test your blood sugar when you're feeling unwell, like Sophia says, that you do break your fast. You don't just look at it and say, oh, my blood sugar is low, it's okay, it's another hour. No, you break it at that point, and Allah knows that you have tried your best to complete it, but you're unwell.
So how do one know that the blood sugar which they are checking is the right ones, or it's now low, or is it high? So what readings are classed as high and low?
So yeah, I'm gonna go on.
So I think, again, we shouldn't give a blanket answer for everyone, because some people, again, the fluctuations in their blood sugar will be quite severe. In general, we say anything under 4, you should have you should have things prepared to have something to eat, something very sugary straight away, and then something a bit more longer acting carbs after that. In terms of high, it depends on what your normal high is. Anything really, I would probably say over 12. If you're fasting, you need to be doing something about. Anything more than that, again, depending on what else you're on.
So I know it's a very awkward question I'm about to ask, and putting both of you in a spotlight. A person who's not diabetic and they try to run the fingerprint test, what figures are normal for them, especially the one who is not diabetic at all?
You mean who have done blood sugar test, who are checking their blood sugars?
Yeah, the fingerprint test for the diabetic fingerprint test,
Yeah,
which
yeah.
person,
So
if a person who's not diabetic and he done fingerprint test. Sorry, I've done it, so and the figures were a bit kind of awkward, so that's why I was thinking of asking.
the fasting should be under 5.2, I think 5.5, 5.2, and the other one, the hyper one, should be less. If like after food, if you check after 2 hours after food, it should be about 7.2 to 9, 10 max. If it's more than that, then that's a sign that you can be pre-diabetic, or you need to, get proper blood test done.
Yeah. Anything, if you do it kind of randomly and you're not diabetic and it's over 11 at any point, you do need to speak to your GP about that.
Okay. That's a good indication to know.
It doesn't necessarily mean that you're diabetic. It just means that we need more tests to figure out where you are on.
Indeed. And that's a really good reassurance in terms of how one should be looking after their own health and well-being, because sometimes these things happen quite often and people don't realize. So in terms of asthma, I know you just mentioned about depending on how asthma is or respiratory issues are. So quickly, before we went on break, can you give us a quick example of what people should do if they're what precaution person should take if they're asthmatic?
Asthmatic, like same, if they need to use their inhaler and they have to use it because they're short of breath, they should use it. They shouldn't think that, oh, I have a fast, I shouldn't use it. But then they should speak to their mom or the person they trust to tell them, advise if their inhaler is okay to use in the fast. And they can, what they can do is, most asthmatic who are well controlled asthmatic, they use their inhalers twice a day, once in the morning and once in the evening. So they can just, use it in the suhoor time, sahri time, and they can use the second dose in the iftar time. So they don't have to take anything in the middle, unless, of course, they need to use the blue inhaler. So it depends on how controlled their asthma is and how how they're feeling that day, because every day won't be the same. So
Indeed. Indeed. And on that note, I must say, wow, we are approaching towards our break. So our break, because we are doing this as an online platform, it will be a very quick, short break, few seconds break. But the people, the listeners who are listening us on Saturday as a recording, they will have a full break in the whole countdown in the same way. So stay tuned. We will be back after very, very, very short break. Stay tuned. So welcome back from our break, and as I said, Assalamu Alaikum and good evening to our listeners who are listening us on Saturday, our show, and this is welcome back to the Health and Fitness Show, and people who are viewing us on our online platform today, which is Thursday, the 15th of April 2021. Welcome back as well from our break. I know it's a very extremely quick, fast break people have ever think of what this break is for, but hey, this is what it is. So, welcome to the Inspire FM special Ramadan broadcast. And as I said, this is a very special Ramadan broadcast. And today we are talking about the medical preparation of Ramadan. And today, joining me today are two lovely doctors, a very good friend of ours. When I say ours, I mean a friend of the show, Dr. Amna Hawash and Dr. Sophia.
Azhar.
Azhar. Thank you so much.
We always
uh,
have to get someone's name.
yes. That's where my dyslexia play come in play. Anyway, Assalamu Alaikum, doctors. How are you guys?
we are fine.
No,
Thank you. Alhamdulillah.
So before we went on break, we were talking about asthmatic patients, and what precautions they should be taken if they're fasting. So and people who are not asthmatic, but they have other condition, other respiratory condition like COPD or regular coughs. What precautions they should be taking, and do they need to fast, especially a person with COPD patients, or have a smoker's cough, which most people say? Amna?
I mean, I think because you've mentioned about smoking, I'm going to jump on that and say that obviously, as doctors, that you stop smoking or at least cut down on your smoking. Not you, obviously, just in general, all of us new people. If you are smoking, this is an opportunity to try and cut down on your smoking, and there are stop smoking services available in Luton. You can just Google Luton Stop Smoking, and there are clinics that run either through your GP or kind of even through town. Sometimes they have things available. So I think that's a very good kind of first step for anyone who is smoking, and to take Ramadan as that opportunity.
Indeed, and it is well, it has its own curves, and Ramadan gives you a perfect opportunity of having that break if you can break. I know some people who do smoke. I remember I was speaking to one of the brothers, and I said to him that why can't he give up smoking because he smoked too much. Because Ramadan, he don't smoke at all any time in the day, and he says, well, that's one of the reason I'm like a chimney after opening our fast. So
but I think from from a kind of a health point of view, I think a lot of people have been looking through lockdown about their kind of general well-being and how they're coping with certain stresses and trying to put in place measures to kind of make life a little bit easier, because it has been so difficult. And a lot of people have turned to things like smoking to kind of help deal with that stress and that isolation. But I think this is a good opportunity. Our whole day is mixed up in Ramadan. The times that we wake up, the times that we eat, the times that, we find time in our day to pray if we normally wouldn't, to do this ibadah and, dua and all of those things. And actually maybe taking a few minutes to think about things like smoking. Why are you smoking? How much are you smoking? Actually, if you can go 18 hours without smoking, what kind of changes could you do outside of those 18 hours to kind of try and cut down, and what effect is that having on your health, and how are you managing those cravings when you're smoking, when you're fasting even and not smoking? So I think this is a really good opportunity to kind of just take a little time to think about our overall health and make just a small goal in terms of just that first step forward. And inshallah, when we do that, Allah helps us through that. And if our intention is right, inshallah, we can make those positive changes to our health.
Indeed. And all it needs is a regular intentions and regular trial, and every single time we have to try. That's the best thing we can do, is to try to move forward in our life in a slightly different manner. But all we can do is try and achieve with some targets if we have set up in our life, especially with smoking as well. So moving on, in terms of the precautions a person should be taking if they have heart conditions. So what precautions they should be taking if they have a heart condition? Sophia?
So I think we said before, it depends on what kind of heart condition they have. So if they are taking tablets that need to be taken on certain times, then probably they shouldn't be fasting. And if they have like heart failure, that is shortness of breath, and they have swelling in the feet, and they have difficulty, doing the daily activities anyway. So probably those people should avoid fasting as well, because the medicine they take depends on the water, how the water is cleared from the body, and it depends on how the heart is working. That's one thing. People who are on some tablets that thin the blood because they have a condition called atrial fibrillation, they can probably be okay fasting. They can take the medicine either in the evening time when they open the fast, or in the morning time when they are when they're doing sehri. But mostly because they take that tablet is normally taken at night time or evening time. They can take it when they open the fast. Again, it depends on how the person is feeling. I mean, if they are struggling to fast, if they're struggling to keep the fast and they are not able to, they're actually harming themselves more by fasting, then I don't think they should avoid it. They should not keep the fast. Yeah.
Indeed.
I think the one thing I would add to that really is about understanding your limits and what you can do to kind of maintain that through Ramadan if you are fasting. So if we put aside, exactly as Sophia said about your tablets and which people can and can't fast, if we have decided that actually it is safe for you to fast, if, for example, you mentioned people with heart failure, we encourage people to keep very active in general for their health. Actually, you need to take a minute and think, okay, what is possible for me to do during Ramadan? And a lot of people will kind of give up completely on things like exercise and say, oh, but I have this condition, I have heart failure, I have whatever. And actually, they might be doing themselves more harm than good. And it is very important that all of us, whether we have a condition or not, that we try and stay active in some way during Ramadan. And I think maybe that's kind of one of the take-home messages I want people to kind of take from this. Just doing a little bit of exercise, keeping active to your limits, and maybe we can give some examples a bit later on, and making sure that you do kind of a warm-up at an appropriate time when you're, for example, not in the middle of the day at midday, try and go for a run. No, be sensible about it, and make a little bit of a plan of how to keep active.
Indeed, 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 and to be honest, there's no better time than now. But before doing that example, before I'll asking you to give those example, I do like to involve our viewers as well. Which, if you have any questions or queries regarding your health, and especially fasting during the month of Ramadan, with any of the long-term condition or any other problems, we have two lovely GPs with us online. Please do post your questions on the chat box, and we can see and we can ask you. So, if so, please, Amna, you were giving some examples, so give it now, please.
So I was just kind of talking about keeping active, and actually that reminded me that last time I was on this show many months ago, Fahad, I think we made a pact that we're going to do skipping. How is that going?
I definitely like to invite you to my house, because I'd like to show you that big hole which I've made it in the ground by just jumping on that place. So yeah, and it's now created a proper foundation for my extension in the backyard.
I'm going to
No,
take that. You were
jokes.
serious and you did
No,
try.
jokes apart. Jokes apart. I did tried, but unfortunately my gouts triggered while I was doing the skipping, and then I have to skip out, unfortunately. Yeah. So that was the real facts behind it, because I'm fasting, so I cannot fly.
But that's actually a really good example that actually we can have all the best will to say we're going to do this and this and this in Ramadan, but it's actually about listening to your body.
Mm.
And actually, if something comes up, you don't just push through it and say, oh, I decided to do this. It's actually saying, okay, this is not sensible. This is not something I'm able to do now. What can I maybe do instead?
Yes, indeed, and that's what we have to do. That's how we take things one step at a time towards our own health. And if somebody told me that our bodies tell us when we are ready to do some things, and how we can shape our body to work on. Like every single day, I was thinking that I will go out for a walk, at least 2 miles of walk, but I cannot do that every single day. So what I do personally, I just walk within my house, just like a squash player works, just going forward and backward for half an hour. And it does having a smartwatch in my hand, it does give me a countdown that how much steps I've taken, how much workout I've done just by moving in that small space. And this is an initiation which I've taken from my dad, because unfortunately he's disabled and he cannot go outside to do his exercise. So he do it within a home, within the confinement of home, on a very small area. But then it helped him some days, but other days he cannot do that. So I've taken that encouragement from him, and I move it. But then again, every day sometimes it's not possible. But yeah.
Yeah, we have to be realistic that we all have very busy lives. We all have lots of other stresses and people depending on us. So it's okay if you can't do it every day, but it's about kind of making that plan and that intention of actually this is what I'm going to do. And that it sounds exactly right. That's exactly what I would advise my patients to do. And even if you mentioned dad is disabled, but even people who are not able to kind of get out of the bed or get out of the chair, there are still exercises that you can do, just even stretching exercises, or just moving your feet if their feet are down, kind of up and down, and stretching exercises. There's lots of things on YouTube. Standing on the spot, sitting and standing, all of those things. It's just about keeping yourself active from whatever your baseline is and trying to just do a little bit on top.
Indeed. So, in terms of moving forward, kidney disease is the other one which you mentioned, or any other long-term or multiple conditions, like multiple conditions who have either asthma or heart conditions, or have more than one multiple conditions which you just mentioned. What advice will both of you give regarding the fasting, in terms of what precaution they should take if they want to fast?
So same thing like Amna said, you need to know your limits. If you are able to do it, then okay, but you shouldn't be struggling to do it. If you think you're gonna struggle, you're gonna harm yourself by doing it, then you shouldn't do it. People who have multiple conditions, they should avoid fasting, because it can just it can harm you more than it can benefit you. I mean, there are lots of benefits for fasting as well, but then if you need to take medication and you're ignoring your medication, you're ignoring your health, you're ignoring your fitness, then probably it's not best for you, isn't it? And then, like Amna said before, there are other things you can do. You can worship more. You can give the fitna you can give and stuff like that. So you should see how you are dealing with it. Like, I mean, I
Exactly,
wouldn't.
Fidya.
Yeah, fidya. Yeah. So
Exactly.
I wouldn't force myself to fast.
Indeed,
If,
indeed,
yeah.
indeed. So one of the other things people do have, and sometimes I do suffer, is the migraine. Should one fast if they suffer regular or severe migraines?
So I
And
have
if they do,
migraine.
what should they do?
So I suffer with migraines, and I suffer with really severe migraines when I do get it. So and I end up vomiting, and my fast is broken, and then I can't fast for a couple of days. What I have learned throughout, I mean, in my condition, is that drinking more water in when I can, when I'm not fasting that time. And then also I take some, maybe just a prophylactic medication you can take. You talk to your GP, and they give you some medicine that can prevent you from having migraines. So that's one thing. But if you are thinking you're having a migraine and you have a headache, and then it's going to get worse by fasting, then I would advise not to, maybe avoid that day, not to fast that day. Give yourself a break, give yourself a rest, try to hydrate yourself, take some painkillers, and see how you're feeling the next day.
Indeed, indeed, and sometimes that's what the best thing to do is to, if you can avoid a day fast, uh, and it helps you to better your health. It's better to avoid the day fast and make it up later on, rather than push yourself to say that yes, you're a super person and Allah rewards you on that section. No, don't try that. Amna, you
Yeah,
want to say something?
yeah, I was just going to add to what you were saying, that our bodies are an amana on us, so we have a right over our bodies to look after them and push them too far, and not put things in them that are harmful, and to kind of do what's best. So actually kind of being a little bit prepared, and it's never too late to be prepared, even if now you're listening to this and you think, actually, well, I didn't know that there was medicines to prevent migraines, or I've been feeling very unwell. Come and speak to your GP and see what things can be done. There's still the rest of the month, 27 more days, or 28 for some people, to get those things in place and started.
Indeed, indeed, indeed. Now, moving on, if somebody have a blood pressure, now this is something very unique, because people always say I have a sugar rather than saying I'm diabetic. So one of the other things people do say, oh, I have a low blood pressure or high blood pressure, and that's why I'm not fasting. Is that a right thing to do? And if somebody is suffering from a high or low blood pressure, what a person should be doing if they want to fast?
So having blood pressure problems in general does not mean that you cannot fast. But again, like we've said so many times, it's a very individual decision based on what other tablets you're on, how your condition is treated, how high your blood pressure is or how low it is, and what your symptoms are when you get that. So actually, some people, like you mentioned, that have very low blood pressure, they have to keep themselves well hydrated and be drinking all the time. They could get dizzy, they could faint, all of those things. So actually, it wouldn't be advisable for them to fast. But it's really just now, especially now after COVID and lockdown, there are so many ways that you can get good advice. So if you have a condition like diabetes, for example, Diabetes UK, if you type Diabetes UK Ramadan, Diabetes UK fasting, there's a whole, lots of information out there from reputable sources that will give you that information specific to your condition. It will say, if you are on this tablet, this is what you can or can't do. But if you have any, questions at all, you can just, send an email to your GP. Now you can do things online, you can call them. It is very easy to get that good health advice rather than kind of anything, I think I would say, kind of generic, or listening to friends and family and making your own decisions.
Indeed, indeed. Sophia, do you want to add anything?
No, same. I mean, it depends on what kind of blood pressure problems you have, but low blood pressure is not exactly a problem, you know. I'm not sure what it means to people when they say they have low blood pressure, unless they have a sepsis, then we can say yes, you know, it's low blood pressure, but high blood pressure is a problem. Um, but it depends again. I mean, you can take your medication divided. You can divide it, take some in the morning, take some in the evening, see how you're feeling. Like again, if you have a headache with a blood pressure, then probably you shouldn't fast that day. If you have high blood pressure that's not controlled and you're having headaches, probably you should avoid it.
Indeed, indeed. And while on medications, if someone is taking medication, regular medication 3 times a day, every single day, so what they should be doing if they want to carry fast? Because if they're having medication 3 times a day, you cannot have that medication and fast. So what changes they need to do, and how can they envisage that change?
So they need to speak to the GP again, and the GP will advise them that which medicine they can take in the morning time and which they can take in, I mean, morning means sahur time, sahari time, and which medicine they can take in the iftari time. I mean, I don't think there's any specific medicine as such that you have to take in the afternoon time. So there can be the rules can be bent like that of the medication. But again, we can't say they can do this unless we know what medication they are taking. So it's best for them to speak to the GP and they can advise them best which medicine they can divide. But yes, they can fast by dividing the medicine.
Amna, do you want to add anything?
No, I think I think it's just about having that conversation, and seeing what else is possible and what medication it is and what else we can do really.
Mm-hmm. So you also mentioned about the ladies who are pregnant and the ones who have in those days. So what advice will you give to? Because I've heard, and there are some sisters which I know did try to attempt to fast, especially in the pregnancy. What is the basic? Because being females yourself, you have gone through that process, so you know it better. What are the advices which you guys like to give to our sisters?
I mean, being pregnant, you're already growing a baby inside you. So, you know, the baby needs nutrients, you need nutrients, and the baby's going to take your nutrients, all of them. So, if you are not going to, you know, put these back in your body, then you'll become deficient, quite deficient. And when you're fasting, you're also tiring yourself, isn't it? It's very exhausting, tiring, especially if that pregnant lady is also working and she also has other children to look after and a household to do, and then she's pregnant or baby is growing inside her, you know. She can also have other problems, like some people have diabetes when they are pregnant, they can have blood pressure problems when they are pregnant. So I mean, they already need to keep themselves fit and well. So by fasting they're going to exhaust their sources. I mean, they can always keep the fast, you know, when they can, when they are not pregnant anymore, when they've delivered the baby and they are, you know, in December or when winters are here, if they're worried about that. But I don't think they should fast. They should avoid fasting.
Indeed, indeed. And sometimes, sorry, Amna, sorry, you were saying
No,
something.
I was just going to add, because you also asked about the women who are on their periods and what they can do, because we get a lot of requests every year for young, fit, healthy women to take tablets to prolong to stop them having periods so that they can fast the whole of Ramadan. Now, having a period, having a baby, breastfeeding, all of those things are a normal part of life that Allah has kind of he's aware that these things happen, and we have that ability or gift, like you said, from him to not fast in those times. Those are very specific things. There is nothing that says that actually in Ramadan you should not have your period and only fast in Ramadan. Actually, no, you should be able to have your period as normal if that's what if it should be coming. Most of us will have a period during Ramadan because it's during the month. And we have to remember that actually, although there are things that we can give as doctors to stop your period, those things are not without risk. And actually everything is a risk and benefit. And if you really do feel that strongly about it, then again, speak to your GP. It may not be suitable for you for various other medical reasons, but just being a little bit easy on yourself, that actually this is something that Allah is aware of, and there is no pressure. I think sometimes there's quite a lot of pressure for people to fast, or for people to not eat, or even if I think we've talked a lot about people who are not fasting and what they do, but actually we have to also remember that if there is a reason, a lot of us in our communities, they will hide away and have something. Oh no, we can't show people that we're not fasting. They will know we're on our period. They will know we're unwell. They will know whatever. No, you are allowed to eat. Obviously, it's about being respectful. There is no need to go and put sweets under the noses of people who are fasting. But actually, we shouldn't feel guilty about that, because a lot of women do feel, such guilt, or such shame that they're not fasting, and they end up not eating, not drinking, not taking the tablets and painkillers if they're in pain because of their periods. And we really, really need to stop that. We need to raise awareness of what is acceptable from a religious point of view, not from a cultural point of view.
Indeed, and that is a brilliant point you have raised, Amna, and I really wanted to shine a light on that particular section. That it is as I said in the beginning, it is permissible by Allah to not to fast if you have any health condition whatsoever, and this is the perfect example you have just explained. Thank you so much. And now on that note, I must say, wow, the time has passed really, really quickly. We are coming towards the end of the show. We just have a few seconds remaining to end the show. So can I ask you both to put a positive comment to finish our first Ramadan Health and Fitness Show special? Starting with you, Sophia.
Okay. I mean, try your best, but don't. If you're struggling, then probably it's not for you.
Perfect.
And Amna? I would say just a couple of things I want to say, please. Firstly, please do come and speak to your GP, speak to a health professional, get some proper advice that is tailored to you exactly, so we can see what changes you need to make, or how we can help you to fast safely if possible, or at least make you understand, be happy with the decision that you're not able to fast. And the second thing, just please try and keep active in some way, after, either right before iftar or between iftar and suhoor, within the limits of what you're able to do. Set some tasks and goals. And can I mention one thing about COVID? The vaccine we've talked about, that it doesn't break your fast if you are able to have it. And also at the moment there's COVID testing kits. So twice a week, they're free, they're available in schools, in pharmacies, they're available to the general public. There's rapid test centres all over Luton, if you just Google that. Please do make use of them. The COVID rates are still going up, and please keep to the government guidelines with Ramadan and with Eid coming up. That is it from me. Ramadan Mubarak.
Ramadan Mubarak, and thank you so much for both of you joining us on this very special show, which we have done very first time ever in a very unique fashion, which we're not live on the air, but we're live on the online platform. So thank you so much to both of you, and thank you so much for our listeners who are listening us on Saturday, or viewers who are viewing us today. Keep remembering us in your duas, as it's the month of dua. We all need to make dua, and we all need to forgive each other. So if we have said something which is not bearable, please do forgive us. It's our effort towards towards your health and our health to be better. Anyhow, thank you so much for joining us today, and thank you so much for being part of the show. We will meet again next week. Until next week, AsSalamu Alikum.
Thank you.